How does patriarchy impact healthcare and feminist bioethics? Imagine a world where the rules of healthcare are shaped by social systems that favor one gender over another. That's what patriarchy does. It's a social system where men hold most of the power and influence in politics, society, and even in healthcare decisions. Feminist bioethics looks closely at how these power structures influence medical practices and ethics. It questions how traditional principles like autonomy and justice might be biased by gender roles. In many healthcare settings, the idea of autonomy is seen as a person making independent choices. But feminist bioethics points out this idea often reflects male norms, ignoring how social relationships and gender roles shape women's lives. It introduces the idea of relational autonomy, which means that a person's ability to make decisions is connected to their social context and relationships. Patriarchal norms can limit women's access to health care, their ability to make choices, and how much their voices are heard in medical settings. Patriarchy also influences what health issues get attention and resources. Historically, research has focused more on male health concerns, leaving women's health needs underfunded and overlooked. Conditions like reproductive health, childbirth, and breast cancer often don't get the same research funding or clinical focus as other diseases. Feminist bioethics calls for changing this bias and making sure research and healthcare policies include women's health concerns equally. Power dynamics in healthcare are also affected by patriarchy. Hierarchical relationships between doctors and patients often reflected paternalistic attitudes, where women's opinions and experiences are dismissed or undervalued. Feminist bioethics promotes care-based ethics, which focus on trust, empathy, and understanding patients' lived experiences. This approach aims to build relationships that respect women's autonomy and social realities. Practically, feminist bioethics encourages healthcare providers to recognize gendered power imbalances. It advocates for involving social and relational contexts in medical decisions. It pushes for research that addresses gender disparities and for policies that promote fairness and inclusion. Care ethics, which prioritize empathy and responsiveness, are central to this approach. They help create a healthcare environment that respects women's voices and experiences, especially those marginalized by patriarchal norms. In essence, patriarchy embeds gender inequalities into the core principles of healthcare. Feminist bioethics works to change this by emphasizing relational autonomy, care ethics, and social justice. Its goal is to reshape healthcare so that it serves everyone fairly, respecting their social contexts and individual needs.